A 12-year-old female with cystic fibrosis, CF, presents with poor weight gain, frequent bulky stools, and signs of malnutrition despite following a typical diet for her age. She has been on CF transmembrane conductance regulator, CFTR, modulators since diagnosis. Family history notes similar gastrointestinal issues in a sibling with CF. On physical examination, the child appears underweight, and her growth parameters are below the expected range for her age. Given the symptoms and history, what is the most likely complication this patient is experiencing? A. Diabetes mellitus. B. Pancreatic insufficiency. C. Gastroesophageal reflux disease. D. Irritable bowel syndrome. The correct answer is B. Pancreatic insufficiency. Most individuals with CF have some degree of pancreatic dysfunction, with up to 85% historically developing clinically significant pancreatic insufficiency. This patient's symptoms of poor weight gain, malnutrition, and frequent bulky stools are classical signs. Pancreatic Enzyme Replacement Therapy, PERT, is indicated, as determined ideally through fecal elastase testing. Dosing of PERT should be aligned with body weight and adjusted based on clinical response. Care must be taken to monitor and prevent complications such as deficiencies in fat-soluble vitamins and growth failure. Thanks for joining this pediatric case review. Remember, early identification and management of CF-related complications are crucial for improving patient outcomes. Subscribe and stay tuned for more pediatric healthcare insights. See you in the next case review.